Did you know that a doctor is more likely to amputate your limb if you are Black? I provide patient advocacy tips and how to navigate the healthcare system in order to stay safe. And one thing that isn't talked about enough in general is racial disparity within healthcare. I did a research paper in college about racial disparity for Black pregnant women. And Black infants' mortality is 2 times higher than white. You are 3 times more likely as a Black woman to pass from pregnancy-related reasons than a white woman. And preterm births are higher. Maternal mortality rates have overall, the rates have dropped, but the racial gap of the mortality has risen. This extends beyond just women and childbirth. You are less likely to be referred to a pain specialist, and you are more likely to be screened for substance abuse if you are Black. According to the American Medical Association Journal of Ethics, Black people are more likely to have limbs amputated. And that is because white people have a higher chance of being provided interventions to save the limb than Black people. Racial biases influence quality of care. I've done a lot of videos on how women in general are not heard within the healthcare system, and that men are much more likely to receive, to be listened to receive care. Now imagine you are a Black woman. You're already at a disadvantage as a woman. You are at an even greater disadvantage as a Black woman. This is unacceptable and it needs to be talked about. How do you educate for yourself and about your health? The first thing is ensure that you are educated about your health. Have an understanding of your health conditions. Secondly, ask questions. Are there alternative treatments available? Why is the doctor recommending this? Are there other things to consider? Find culturally competent providers. Have a copy of your records, your test results, and know your rights. Know your rights to a second opinion. And as healthcare clinicians, there are racial biases, there are racial disparities, and we probably have them. So everyone needs to take a good look at themselves and ensure that we are treating and advocating for patients equally.